On April 1, 2026, the Dutch expedition ship MV Hondius departed Ushuaia, Argentina. On board were 147 passengers and crew members representing 23 different countries, setting off on a transatlantic voyage through the remote South Atlantic islands. On April 6, 5 days into the itinerary, an adult male passenger developed a sudden fever, headache, and diarrhea. His condition quickly deteriorated into severe respiratory distress, and he died on board on April 11th. At the time, no microbiological tests were performed to determine the cause. The transmission moved beyond the vessel when the index case's spouse disembarked at St. Helena. She boarded a flight to Johannesburg, South Africa, but died shortly after arriving at an emergency department on April 26th. Post-mortem testing confirmed she was carrying a hantavirus. By May 2nd, the World Health Organization was formally notified of the cluster after a third passenger fell ill. This patient was hospitalized in critical condition, and laboratory confirmation of hantavirus in their system solidified the link between the cases. In less than 1 month, a single transatlantic voyage had linked 23 nations into an active epidemiological chain. What was planned as a nature tour had become a multi-country medical investigation involving 3 fatalities and international contact tracing. Genomic sequencing performed in South Africa identified the specific culprit as the Andes virus. While most hantaviruses require a direct jump from a rodent to a human, the Andes strain is different. It is the only known hantavirus capable of sustaining limited person-to-person transmission, typically through close, prolonged contact. This rare biological capability made the MV Hondius an ideal environment for a cluster. The high-density, confined nature of a cruise ship allows the Andes virus to move between human hosts without the need for a rodent intermediary. This human-to-human capability alters the global risk assessment for the virus. It means an outbreak is no longer anchored to the specific geographic range of an infected rodent population. It can travel as far as its human hosts can fly. This technical diagram shows the hantavirus virion. Its single-stranded RNA features a tripartite genome with 3 coiled segments. The small segment protects the RNA, the large encodes replication enzymes, and the medium segment produces surface glycoproteins, allowing the virus to fuse with host cells. Wild rodents serve as the primary reservoir for these pathogens. They carry the virus chronically and asymptomatically, shedding it into their environment through urine, saliva, and droppings. When rodent nests or droppings are disturbed in an enclosed space, the virus becomes aerosolized. These microscopic particles are suspended in the air and inhaled, allowing the virus to enter the human respiratory system. The virus's physical structure allows it to persist in the environment outside of a host. This makes it an invisible threat in any infested or poorly ventilated area where dried rodent waste might be present. Symptoms generally appear 1 to 8 weeks after exposure. The infection typically begins with nonspecific flu-like aches, fever, and gastrointestinal issues, such as abdominal pain and vomiting. In cases of Hantavirus Pulmonary Syndrome, or HPS, the illness progresses rapidly. The lungs fill with fluid, a condition known as pulmonary edema, leading to bilateral diffuse infiltrates and severe respiratory failure. This contrasts with hemorrhagic fever with renal syndrome, or HFRS. While HPS targets the lungs, HFRS primarily attacks the kidneys, causing internal bleeding, low blood pressure, and acute renal failure. Because early symptoms are common to many respiratory illnesses, diagnosis relies on specialized laboratory work. Clinicians use ELISA to detect IgM antibodies and RT-PCR to identify the presence of viral RNA during the acute phase of the illness. The similarity between hantavirus and more common infections, like influenza or COVID-19, makes these tests a requirement for survival. Without early laboratory confirmation, the window for effective supportive care often closes before the virus is identified. There is currently no specific antiviral treatment or approved vaccine for hantaviruses. Once a patient is symptomatic, medical teams must rely on supportive care within an intensive care unit to manage the disease's progression. Life-saving measures include mechanical ventilation to combat respiratory distress and dialysis to manage kidney failure. These interventions stabilize the patient while the immune system attempts to clear the virus. Because there is no medical cure, prevention is the only reliable defense. The most important rule is to never sweep or vacuum rodent droppings. These actions create the very aerosols that carry the virus into the lungs. Safe cleaning requires soaking contaminated areas with a 10% bleach solution for several minutes. This inactivates the virus, allowing the material to be wiped up safely with paper towels without launching viral particles into the air. Rigorous environmental control and the use of personal protective equipment are the only way to prevent a lethal spillover. In the absence of a vaccine, hygiene is the primary defense. Climate change is currently reshaping the risk of these infections. Warming temperatures are causing rodent reservoirs to expand into new territories, increasing the frequency of contact between humans and virus-carrying animals. This makes international monitoring more important than ever, but the United States faces a unique challenge. Following its 2025 withdrawal from the World Health Organization, the U.S. is no longer part of the real-time health monitoring and data sharing networks that coordinate global responses to these outbreaks. This lack of real-time visibility is significant because 11 American cities will host millions of international travelers for the 2026 FIFA World Cup. In high-density urban crowds, a human-to-human strain like the Andes virus could move through contacts long before health authorities realize an imported case has arrived. The MV Hondius crisis serves as a reminder that rare pathogens can appear in unexpected settings. In an era of ecological change and global travel, the ability to detect and contain these viruses depends on renewed cooperation and transparent health surveillance.